for wasting your time. Anyway, thank you, Vaughan, for setting up this meeting and giving us the opportunity to share with you what it is that the Colt Foundation does and our funding opportunities and how we can work with you guys moving forward. So the Colt Foundation, what we do, for those of you who don't know what we do, we fund high quality research into in the field of occupational and environmental health. We historically have funded, we like to fund projects that will discover, aimed at discovering the causes of illnesses arising from conditions at the place of work. And over the years, we've funded things like occupational health disease, asbestosis, silicosis, work-exacerbated asthma. We've also looked at secondary trauma in the military and the coroner's courts. We've looked at physical and nutritional health programs for truck drivers, barriers to employment for autistic adults, large data analysis, things like longitudinal studies using large data sets to examine the health and occupational outcomes for UK veterans, chronic kidney disease of unknown origin in Central American agriculture workers, numerous nanotoxicology projects, just a broad spectrum of occupational health research that we are interested in to really sort of give you an idea of that we are, it's a broad church here. We don't focus specifically in one area. But what we do insist on is that it is likely to inform policy and improve working practices. And recently we've we're still very much funding project grants, but we are focusing a little bit now on to proactively support individuals who wish to have a long-term career in work and health research, and we're doing that through various fellowship programs that we have. So just to break down a little bit more about what it is that we have on offer for you, at the moment we have 4 specific funding streams. We will be expanding on this over the coming year or so, but for now, this is where we are focused. So traditional project grants, PhD fellowships, scientific fellowships, and clinical fellowships. Our clinical fellowships we co-fund with NIHR. So project grants, we award twice a year in open competition. This is the same. What we expect and the quality of applications is you'll be very familiar with this because it's similar to what other funding bodies expect. But where we are different is we don't theme our calls, generally speaking, or we don't at all. What we do like, and what has proven to be quite useful, is to have a pre-submission 1-page overview of the proposed project. That's we're finding incredibly helpful for our end as well as for your end, because we will look at it, give you feedback and allow you time to then work up a full application in the knowledge that your application is within our remit and an area of interest to us. We don't want you to be wasting your valuable time writing project grants that just won't get through the initial selection. We don't have an average duration. Usually anything between 6 months and 3 years, but then we've done a little less, we've done a little more. So there's no, we're not set in stone the duration. Our budgets are between 50,000 and 250,000, give or take. And then we will go through external reviews, which you will have a chance to comment on before it goes back to the board, with annual meetings for projects over 12 months. So that's our project grants. PhD fellowships, this is a program that we actually run incredibly successfully now for 35 plus years. We award up to 4 fellowships a year. They are 3 years. We allow part-time, we allow career breaks. We are very keen to support and nurture our PhD fellows. So we invite them to an annual day which we hold in central London, where they will present their findings for each of the 3 years or more than 3 years if they're taking part-time. for us to sort of keep an eye on and support their research as they go through their PhD. And it's also a wonderful networking opportunity for our PhD students to meet other like-minded people and the other students that we support and other senior academics. It's a friendly, invited audience, which has proven to be incredibly useful over the years. We have a mentor network where we introduce our PhD students to academics, clinicians, well, academics outside of their immediate area of research, which just gives them somewhere else to sort of offload. And I mean, as you know, all of you have done a PhD, it's incredibly hard work and stressful, and sometimes it's quite nice to be able to just take it away and have somebody else to talk to and support you. And I'm always available for anybody who would be who needs to some support. The deadline for this year's application is the 27th of April. All this information is on our website, so you can always go back and have a look at that. And I'm very happy to share my slides. We also have now a scientific non-clinical fellowship, which is really about building capacity and offering job security for scientists who are just sort of embarking on their senior lecturer role. We offer 100% salary for 5 years, and we will give you £150,000 worth of research costs for an initial project, which we would not expect to last for the 5 years. 2 to 3 years of your fellowship, and we would anticipate that you would, or we would expect you to apply to us and other funding organisations for further research costs for the duration of that 5-year fellowship. Applicants will have a track record of high quality research relating to occupational and environmental health. We are very keen to be supporting people who want to have a long-term career in this discipline, and that's really vitally important for us. Again, 3 years postdoc, no more than 10, but again, if anyone's had a career break, we will look at that. There is nothing is ever set in stone with the Colt Foundation. We can be flexible, and it's just a question of just contacting me and we can work through things. But these are our guides to what the parameters, what it is we like to work within. And then we have the NIHR Colt Foundation Advanced Clinical Fellowship, which I won't really talk very much about because I know Faheem and team are going to be talking a bit more about their various fellowship schemes, and this just sits within their Advanced Clinical Fellowship. But we're very excited that we can co-fund with NIHR, because this offers access to the CRN and other very useful resources that NIHR share, have available to you all. And just a little bit about what it is that and this is for all fellowships, project grants, any application to us. This is relevant to for everything. We now ask for a pre-submission one-pager, really just so that, as I said earlier, we can make sure that you're not wasting your time, and we can give you feedback on your proposal, but prior to you working up a full application. But the things that are absolutely critically important is for us to be able to understand when you're putting an application into us is, what is your research question? Why is it important? That's absolutely vital. How you propose to address these your questions, what difference will it make? This is into policy and the like, and is it going to offer value for money? And that really is a sort of summary of what it is that we would expect your application to have in it. And just please just send it to me, contact me at any time if you've got any questions, and I'm very happy to respond and help you in any way that I can going forward. So that is really a whistle-stop tour of what it is that the Colt Foundation do and how we can support you. More information is on the website, and please just get in touch with me if you've got any specific questions. And there's no such thing as a stupid question. I know that. Anyway, thank you very much.
Thank you very much, Tash, for that excellent overview of the various different awards that are available from the Colt Foundation. That was a fantastic presentation. We'll hold questions for now, and we'll just hand straight over to our colleagues at the NIHR Academy, and then we shall open it up for questions. Yes. Yeah.
Okay. So afternoon all. Thank you for joining us today. Nice to see many of you on this call. So myself and Suzanne will give a brief introduction to the NIHR Academy, a bit of an overview of what the Academy provides, and then we'll touch on the sort of personal awards that we look after, such as the pre-doctoral, doctoral and postdoctoral awards. And then Professor Jayne Woodside, who's kindly offered to join us, is a funding committee on the doctoral fellowship, and she'll sort of touch base on what makes a good fellowship application and what she looks for when she's reviewing applications.
Afternoon, everyone. So the NIHR's core vision is to improve the health and wealth of the nation through research. Some of the key principles are research impact and how knowledge generates from research, the benefit to people's health and well-being, how health and care research are delivered, and what benefits it can bring to our society and economy.
So the NIHR Academy, we're responsible for the development and coordination of academic training, career development and research capacity development. We offer a wide range of training and career development support through the Academy, and we offer a load of awards that are available at different levels. So this can be accessible by different people of professional backgrounds. These awards will comprise of both personal awards, and then which can be applied directly by applicants, or institutional awards which can be applied by the host institution. So as you can see, we offer various range of awards from initial experience to PhD all the way to a chair level. And then we also have some additional awards such as career development, so we can offer a pre-application support fund. And then we've also got a few new research programs that have come on board, such as the Team Science Award.
So as Faheem mentioned, we offer such a wide range of support from undergraduate levels to research leaders. And here on your screen, you can just see a quick recap of award levels that we fund. We do ask that any research being carried out must be relevant to the health and care within the aim of benefiting patients and or the public within 5 years of its completion.
So all our awards need to sit within the NIHR remit. So this is that the overall remit of the NIHR is anything early translational, experimental medicine, clinical and applied healthcare research, and social care research. So all proposals must have a clear potential to patient benefit or public and service users. We also ask that for the doctoral level, so of early translational medicine research is not within remit. However, for the advanced sort of awards, this would be within remit as long as you can identify and show a clear-cut patient benefit. We don't support any work with basic research work or anything involving animals or their tissue. We do fund work with biomarkers, but again, as long as you can show that there's a clear patient benefit in terms of the biomarkers being proposed, this would be funded. However, if you're proposing any biomarker work that sort of just sits to find out the mechanistic work behind the disease, then this would be out of remit.
So as some of you may already be aware, as of 2025, the Academy has simplified the current offer, condensing previous awards into more simplified offers at all levels to ensure our career development opportunities are accessible and easy to understand. However, no funding is being lost, and we've continued to maintain the same level of funding opportunities as previous. Here you can see the current awards and the new simplified offer. As well, on the right-hand side, you can see the funding committee that's being created and allocated to the relevant award expertise to assess each application.
So moving on to some of our personal awards. So starting off with the pre-doctoral award. This is an award designed to advance your health and social care research at a master's level. The award is available to anyone sort of working in a local authority or an associated setting, any registered HCPs or working in NHS settings. It's open to general practitioners, dentists, practitioners, etc. For the pre-doctoral award, you can propose to undertake training to develop further as a methodologist in any of the applicable methodology areas. But again, this would be indicated in our guidance notes when the scheme launches. The pre-doctoral award launches annually every January, and we offer funding for your full salary, full master's fees at the UK rate or 5,000 bespoke. We provide conference fees, which is at £1,000, £1,000 for supervisory fees and £1,000 for PPI and research inclusion.
So then moving on to the doctoral award, it's a flexible award that can be undertaken across 3 years full-time or part-time and will allow you to undertake a PhD in applied health and social care research. It's open to all aspiring research leaders within health and social care where their research proposals will fall within the NIHR remit for personal awards, as Faheem previously mentioned. It's worth noting that clinicians, practitioners and those based in local authority settings have the option to include around 20% of funded clinical or practice time within the award. Each applicant must hold a first class or upper second class bachelor's degree or master's degree. And if you have already registered for a PhD, you must not have been registered for more than 12 months at 100% WTE by the time the award starts. This award offers funding for full salary for the whole duration of the award. It includes research costs, PPI costs, training and development costs, and conference fees and associated costs that are capped at £3,000, as well as full PhD fees. You can also apply for co-funding with charity partnerships that participate in each cohort that you're applying for, and this will be mentioned in the guidance notes that will be added to the website when the award is launched. And the award launches twice a year in both April and October.
And then finally, moving on to the postdoctoral award. So again, similar to the doctoral award, it's a flexible award that can be completed between 2 to 5 years full time. This is available to anyone that has a PhD who has not yet been awarded a chair. So anyone with a professor role would not be eligible for an advanced for a postdoctoral award. Again, open to all health and care professional backgrounds. Must have recently completed or submitted their PhD, have started to establish themselves as independent researcher already established but not yet recognised in their sort of research field. Similarly to the doctoral award, we offer funding for full salary, support staff costs, training development costs and conference costs. However, for the postdoctoral award, the conference cost fees are £2,000 per year. And we also allow you to include any support staff costs, so you can cost in a research associate if needed. Again, you can also apply for co-funding with charity partnerships, and we ask for the advanced fellowships for the postdoctoral award. Any registered practitioners can dedicate up to 40% of the award to development of their own sort of career development within the advanced fellowship, and again, this will be funded by the NIHR. Again, this award will launch twice annually in spring and autumn. And then moving on to charity partnerships. So as Tash mentioned as well, so we're working with a number of charities across our schemes, and this is where we're looking to co-fund and offer jointly funded fellowships. So this provides support to applicants where you can collaborate with two funders, so obviously the NIHR and then a charity of your choice. You can become part of two research communities to support your fellowships to get into your next career stage. And each application will go through the same review process as all our applications made in the round. And if deemed fundable by the NIHR funding committee, the NIHR and charity co-fund the fellowship, or the NIHR will fund the full fellowship. So we ask that there's a lot of benefits of working with charities. You can share knowledge of national research landscape to help build research questions. We can work together to identify research needs, and obviously we can collaborate to co-fund research projects, funding calls or programs. Ultimately, we can share knowledge and disseminate research findings a lot wider to our networks. So we always ask, if there is a sort of research area where you think you can collaborate with a charity partnership, you indicate this on your application form. I'm going to pass you over to Professor Jayne Woodside, who's going to touch briefly on what makes a good fellowship application.
So good afternoon, everybody. Delighted to be here and give a few thoughts around what makes a good fellowship application. So as Faheem has said, I'm a Professor of Human Nutrition at Queen's. I've been on the doctoral panel now for quite a few years, and I'm now one of the deputy chairs of that panel. So thinking about what comes to the panel and what the panel are looking out for, some of these things would be fairly obvious, but I think it's worth reiterating them. So firstly, you need to write clearly. The panel will be seeing a broad range of applications from diverse disciplines, so your application does need to be written so that a non-expert can understand it. try to get across early on the importance and the impact of what you want to do. And the best way to make that application stand out and be understood easily by the panel is to write clearly. And for that reason, I think we would suggest to get people who are not within your discipline and perhaps even are complete non-experts to read your application and provide feedback, just to make it clear that what you want to do and are planning to do does come across clearly. That will obviously then help you craft and refine your application. And I suppose that leads to another suggestion is to take plenty of time to prepare your application. Don't fire it in too soon. The calls come out regularly. It's worth taking those extra few months and really crafting and refining what will then be a better application that has more chance of success. You then need to demonstrate the importance of what you want to do, why you need the fellowship and the difference it will make to your career. Try to get across how passionate you are about the project and your own development as a health and care researcher, where you are now within your career and how that fellowship award will help you build in your experience and what skills it will help you gain. NIHR are very keen for develop research partnerships and capacity within the NHS with public health, social care and other organisations, as I think has already been demonstrated. So, think about that and try to build that in and make it clear within your application. Because it is a fellowship, there has to be a training plan. So it's not just about the research that you will undertake, it's about the training, career development and opportunity that you build in. That is central, the training plan, and you should therefore highlight, first of all, the skills you need to gain to progress to the next stage of your career, over and above the training you need to complete your project. So it's not just project-specific training, it's about thinking of this as a fellowship, not as a research grant, and how you've built in training that will allow you to develop and become a research leader of the future. And the best applicants do align their training plan with their research plan. But it's absolutely vital that that training plan is not an add-on, it's an essential core part of the application, and it's scored as such whenever the panel review the applications. Can I have the next slide, please, Faheem? You then are embedded within a host organisation to do your research. So you need to think about that institution, whether it's right for the research that you want to do, and you align yourself within the application with that institution and the groups within that institution for your project. You need to demonstrate in your application how that specific institution will support you as you undertake the fellowship and develop as a research leader. So that's really important. There's a host organisation statement on the application. So again, it's worth really paying close attention to that and crafting it carefully. You then include a number of supervisors, up to 4 supervisors. And again, the panel will look at that closely. Do those supervisors support the various elements of the application? So your choice of those supervisors is critically important, because if you don't have the right people with the right skills to advise you, then we would score applications lower in that area. The project is no doubt important. It's the platform on which some of your training will be based. So we expect to see that those projects are well thought out. We expect to see that the methodology is appropriate and that there's a plan for applying those methods that will allow you to deliver your project. The timeline is absolutely vital. So the project needs to be achievable within the time frame of the funding period. So you need to be ambitious, yes, but you should not be over ambitious where it will be really apparent that you simply cannot deliver on what you're saying you're going to deliver within the time frame. And as Faheem and Suzanne have already said, you need to ensure your project meets the NIHR remit for personal awards. PPIE, so patient and public involvement and engagement, again, absolutely vital to have that as a well-developed and designed plan within your application. PPIE engagement and involvement should start right from the outset, so there should be PPIE involvement to shape your ideas, and that will strengthen your plans. So the best applications will have PPIE throughout them and show how the project will ultimately impact on patients and population. So again, it can't be an afterthought. It can't be that I will develop a group whenever I get funded. That will not wash. It has got to be already engaged and already having contribution as your plan develops. So I think I've already said this, but give yourself time to develop your application, craft it, seek advice and guidance and feedback from others along the way. From being a committee member, you can see it when that has been done. We appreciate it when an application has everything lined up and can show that ultimately they will make a difference. So thank you very much.
Thank you. That's everything from us.
Thank you very much. That was a very useful insight into the various different awards that are available from NIHR.